Good afternoon, everybody. Today is April 9th, 2021. My name's Scott McGann with the Falmouth Health Department doing our weekly COVID-19 update. The website for the most recent up-to-date information is falmouthma.gov, health at falmouthma.gov, or 495-7485 for our phone number, which would be non-vaccine or appointment-related questions. It could be vaccine, just don't ask for an appointment. That's not how it works. But if you have COVID questions, concerns, contact tracing questions, things of that nature, you would call that number. There's also a COVID hotline through the county at 774-330-3001. So let's start talking about vaccines. Eligibility increased to phase 2, step 5, which is individuals 55 and over, and any individual over the age of 16, which is the vaccines are approved for, with one certain medical condition listed, are all eligible. So we're about 2 weeks away, a little less than 2 weeks away from having all individuals over the age of 16. If you fall into phase 2, what's going to happen when the eligibility goes up at the 19th, the ability to get vaccine is going to be bottlenecked again. There's only so much vaccine. When you open it up to a larger group, it's going to be more difficult. So if you fall into phase 2 or you're in phase 1 and now you're looking for a vaccine, you really need to work hard over the next couple of weeks prior to, just because knowing what going through this and when we increase eligibility, especially when it's a large number like this, it's going to take a while for that bottleneck to sort of thin itself out. It's going to take a while for everybody who's now eligible to find an appointment. So I would encourage you, if you're in phase 2 and you're still looking to, keep going. Because that's just what's going to happen. And then that bottleneck will thin out, and then, we'll be in great shape after that. It just takes that first week or two when an eligibility changes, vaccines become more scarce, appointments become more scarce. Vaccine doesn't become more scarce, just the appointments, because the demand goes up. So there's a couple things you can do. Each week on our website, like today at 4 o'clock, there's a clinic in Orleans for 1,000 doses. At 4 o'clock, you can register. A couple things you can do. You can go on barnstablecountyhealth.org or our website. barnstablecountyhealth.org will come up with ask you if you want to have notifications, put your email in, become notified. Our website, we also posted, I think it's up there probably right about now, and with all the links to register yourself for that 4 o'clock at Orleans. For state sites, you would pre-register on the right. I show you what the website looks like. You would pre-register, and they would contact you when an appointment comes up either by text or by email. And then you would have 24 hours to make your appointment. That would only be for state sites like Gillette and Dartmouth. Barnstable County comes out every Friday. And that may change in a week or two. We may start going more towards a similar system. Things always change, so I'll obviously update the website and update these as if things change. The county one you'd get through maimmunizations.org. You can go on mass.gov, vaccine availability. Eventually it will take you to mass immunizations, or you can cut right to it. So the Cape Cod Regional Vaccine Consortium, again, if you're over the age of 60 and you've not had luck online registering, you're vulnerable, you're having trouble with the whole online system, you'd want to call the senior center. They'll give you an interview, and if you're qualified, they will send your information to Cape Cod Healthcare, and then they'll call you. Obviously, the only problem with that is a lot of people do not answer the phones when they get a weird number. If you've called the senior center and we're going to forward your name, make sure you're answering all phones, because what's happening is when Cape Cod Healthcare has been calling a lot of people, they are not getting a lot of responses because, like a lot of people, you don't recognize the number on your cell phone and you don't answer. But if you do get on this list, then you would want to do that. If you're homebound, you also want to call the senior center, 540-0196. The Community Health Center of Cape Cod has done all our homebound that's on our list just about, and so you want to call that as well. Second dose appointments, you could also call the senior center or the health department. We do have a link that we would give you the name to Cape Cod Healthcare in Barnstable County, put you on a list of those seeking second doses. Again, if you're 55, if you're in phase 2 and you want a dose, work really hard over the next couple of weeks. So where do we stand? The supplies, I think this week we actually had 4,500 doses to the county, but generally speaking, we'll get 3 cases of Pfizer, which is 3,510 a week. This past 2 weeks, we've had 1 clinic each week at the fairgrounds and 4 clinics, 2 each week at 4Cs. Next week, we're doing some second dose at 4Cs, so there's not going to be much availability for a county clinic because those doses have to go to second doses. There'll be 1,000 dose clinic that goes on, like I said, at 4 o'clock in Orleans at the DPW. It's also a drive-through. It's a nice system, similar to like the fairgrounds. you can register for that one at Orleans. That'll be next week, okay? Usually that eligibility is on Fridays for the following week's clinics. Obviously, we're getting rid of the dose as soon as we had them. We could be running the fairgrounds much more frequently. I think things will be in much better shape in a couple of weeks. I think we're going to start seeing some more doses. Where you're seeing most of the doses are at pharmacies. That's been the largest increase. So your availability, which you should be doing as well, is checking the pharmacies, getting on their lists or however they work it, try to get pre-registered or try to get registered for a clinic, because they're seeing, they go directly from the feds for their vaccine, and they're seeing a bigger increase than, let's say, the county is getting. The county will start getting some more, I think, a little bit more, but, again, that's the places that you want to go. So mass vac sites and pharmacies tend to get the most. Cape Cod Healthcare and the community health centers also getting them, so you may start seeing clinics run in tandem eventually, where we would run something at the fairgrounds with Barnstable County, but we might do another one with maybe some other entity like Cape Cod Healthcare. That's still to be determined, but we're working through all that. The consortium's working through that. So again, if you're a veteran, you can go to the VA hospitals. Pharmacies, keep checking them, and then the Barnstable County again is still on Friday registration. If that changes, I'll definitely put the updates on our website. How are we doing? Well, we hit the 50% with single doses in the county, which is a 6% increase over last week. So that's good. We're 50% of people have had at least one dose in the county, highest in which it should be, because we have the oldest population, so it makes total sense to me. We're at 50% at least single doses. In terms of second doses, meaning done, we're at 32%. So we're almost a third of the way through fully vaccinating. That's a 5% increase from last week. Again, this stuff is not stuff that I get special. You can get this at the same daily websites. This is done weekly. Every day the state updates the cases on the Mass COVID dashboard. Once a week you can get this vaccination data as well. So you don't have to wait for me to say it on this call. In the town of Falmouth, so we have good news on here. So over 75, we have 91%. We're a 1% increase. We're getting close to saturation. Again, if you're in that age group and you're struggling, I still get emails. You need to be calling the senior center if you're struggling to get a dose. We will get you on a list with Cape Cod Healthcare. That system does work. Just keep your phone open to answering all your calls, and we'll get you in. In terms of 75 second doses, 13% increase. So we're at 3/4 of the town over 75 has taken 2 doses and been fully vaccinated. Fully vaccinated would also be 1 dose of Johnson & Johnson, but most of the vaccines on the Cape have been either Moderna or Pfizer. Between 65 and 75, it's 83%, a 3% increase. 63%, or almost 2/3, 65 and older, have been fully vaccinated. 50 to 64, we're up 12% to 54% have had at least 1 dose. 24%, or a quarter of our 50 to 65-year-olds, and a 5% increase have had their second doses. For 30 to 49, it's 36 and 18. For 20 to 29, it's 25 and 12. And 0 to 19. So everything's on the uptick. We're still plugging away, getting rid of the vaccines as soon as we get them. The community health center, Cape Cod Healthcare, has been getting an increase. They've been doing it as well, and so it's all hands on deck, and we're making progress. In terms of cases, there were 1,435 total cases since March 19th of last year. There's been 54 for the week, 18 this week of probable, 98 total probable cases since the 1st. We're representing about 11.3 of all cases in Barnstable County. Contact tracing, we still do contact tracing as good as ever, strongly as ever, so we haven't stopped doing that. We did find both the P1 and the B117 variants have both been found in town, so those more highly transmittable, especially the B117, is here. So again, we need to make sure we're doing precautions. But all in large, it's a better week than we had the previous week, so that's where we're at. You can see where the last 2 weeks we had that 7 weeks or so of the 25 to 35 case count. We jumped up into the 90s last week. This particular week we're at 54. Hopefully that trend continues. We don't know. With both variants and the ability to spread, and also some of the ability to maybe reinfect, is an issue. So again, the due diligence still needs to occur. This is our cumulative cases as well. Jumping on to the color chart, the green, yellow, and red, the state changed it, how it looks. You can call that up on the state site. I'll show you in a second. It now shows a map. We remain yellow. We've been able to stay yellow through this most recent wave. Mid-Cape is still in the red, still having a lot of cases. Our positivity jumped from 3.16 to 4.48. If we have another week of a jump, we'll be over 5. Over 5% would put us in red. Barnstable County has the second highest to Dukes and Nantucket, to Dukes County in Nantucket, which is the Vineyard in Nantucket. They were over 8%, where the county was 5.79, where the state's 2.54. So we're now the hot spot. Where we generally weren't the hot spot for the last month or so, we've been the hot spot in the state. And the state's doing extra focus on checking for variants and so forth, and then, so we're being monitored closely by the state as well. So everybody has to just sort of keep plugging along with the social distancing and masks and that stuff. Just to show you the infections, I drew a line at 30. The red line indicates 30 infections per 100,000. You can see that back last week, we started to have towns creeping over that number. You see even more towns creeping over as well, including us. So the cases are on the increase. Are still relatively high, and so we just need, again, just to keep bearing down. In terms of cases, you can see this is the daily count case for Barnstable County. We're still amidst that March sort of spike that we've had. It looks maybe slightly better, maybe over the last week or so. We'll see. We'll need a little bit more time on that. Hospitalizations, a little bit down at Cape Cod Hospital. You see that they were in the 20s, the last 20s up to 30 over the previous couple of weeks. This week they were at 16. And we've been sort of in that, we're a little bit higher with 5, but we've been sort of less than 5 for a while now. Part of it's because if you look at the age group at which people are getting affected, you can see it here in this chart. This is the daily chart. So if you see on the right, in the left-hand column, you see city and town data. I have my cursor running over it, but city and town, that's where you can get that yellow, green, red chart and information about each town. So you just click on each one. So today is the overview from yesterday, roughly between 15 and 2,200 cases where we've been averaging. We're at 19%. Positivity is a little bit down, actually, which is good, to 2.29. It was getting up there around the 2.5 range. But if you look at the cases, you can see the cases have been younger age graphic, which are those that have been often vaccinated. So if you want to know if the vaccine's been working well, you do see a lot less numbers in the age group that have been eligible for vaccines for a little bit of time now. You also see deaths that have been down a bit. So that's also an indicator that the younger, more cases are occurring in a younger and more healthier population. The trends are still sort of flatter down a little bit. So for the most part, I think they're pretty flat. And so they should, hopefully with more vaccine, start continuing to creep down. As far as testing hasn't changed, you can do either the hospital through the dedicated call center through Cape Cod Healthcare. You can also go to the convenient MDs, the East Falmouth CVS, Community Health Center of Cape Cod also, I believe, does it. There's also a free drive-through testing. What we do is use the Barnstable County Fairgrounds that we do for COVID testing. We have the same setup for COVID testing. It's also PCR. You can either go on capecodfairgrounds.org and actually just fail out the information right then and there. You could call them. It's quicker to go on do it on capecodfairgrounds.org. So Barnstable County's website, Barnstable County Fairgrounds website. Sorry, they generally do it on Tuesdays and Fridays. They staff it on those 2 days, but that would be free. So there's plenty of capacity to do testing there. Again, this slide's been up for months. Again, it's really stay at home when ill, self-isolate, get tested, listen to the contact traces, follow what we tell you, keep with the diligence with the social distance and the face coverings. Maybe I'll expand on that in the next meeting. When you are vaccinated, among 2 vaccinated people, they're shying away from worrying too much about it. But again, if you're not vaccinated or don't know, or you're in a public building, things of that nature, make sure you're still following the face coverings. We're not getting rid of that anytime soon. Hand washing, hand sanitizing, travel is still in a common area, which you get it. Gatherings, parties, that types of things still occur and do cause issues. One thing I did notice about the variants is that it does spread much better among households. So sometimes when it's been able to, with the old COVID, I guess, the original COVID, you'd see it go through another person at the house. Now you're seeing it go through almost everybody in the house because it's got more spreadability, especially the British variant. So be cautious with that. So that's part of the reasons why we're seeing the increase in case counts, is that we're seeing households have more cases within it once one person brings it in. Again, the guidance will be changing. It'll get looser as the disease goes away and vaccinations go up. But right now, you need to be following the state guidance, especially if you're a place of worship, workplace, if you're doing, team sports, any of that kind of stuff. It's very well laid out on the website. It might be a little cumbersome to get to, but it's on there. Again, that's where you can contact the health department too. We can walk you through guidance. To recap, eligibility is now 55 plus. We got 2 weeks to get to less than that. Now we got 10 days before it becomes 16 plus. Falmouth resident vaccines are similar to other Cape Towns. We're all pretty similar. State metrics are showing a leveling off of cases, but still a little bit on the high side. Barnstable County are the second highest in the state. So let's just say Barnstable County and Dukes and Nantucket is the highest area in the state for infections. Lower this week for our case count, still on the high side. P1 and B117 are present. Community spread does occur. And also regionally, we're getting rid of the vaccines as quick as we can, with Cape Cod Healthcare, the community health center, and pharmacies being where most of more of an increase of vaccines is occurring. So that's where we are for this week's update, and we'll see everybody next week. Thanks.